Hey guys, it's been a really, really long time, and I'm sorry. I was just trying to get myself together. This is a really hard thing, and I got really depressed for a while, kind of lost myself, but now I'm trying to come back. And in this journey, I've learned so much, and I'm going to try to get it out into this video as much as I can. Remember, off the top of my head, I don't have a list written. Yeah. So first off, I have two theories about interstitial cystitis. First theory, it is caused by macrobid or nitrofurantoin, or however you pronounce it. They're the same drug, and they have chemicals in it that turn into bleach in your system. So our bladders have been bleached. I've spoken to many women who were prescribed with nitrofurantoin or macrobid right before they were diagnosed with IC. So stay away from macrobid. Second theory, and this one's a doozy. Nobody get mad at me for saying this, because I feel the pain too. IC doesn't exist. Now, that is up for debate, and as I said, it's a theory. I think that sometimes when we're not active or we're overactive, our muscles get so tight in these areas. Our pelvic floor comes together and it starts putting pressure on our bladder, and we have no knowledge ourselves of how to release these muscles. So it's putting pressure on our bladders, and it's making it hard to hold, having to go to the bathroom. It's giving us sharp pains. This is the case with a lot of women. I'm in physical therapy now. I've been in physical therapy for about 3 months for my pelvic floor. It's pretty interesting. Pretty interesting stuff. I have learned so much about the female body and just the different muscles down there and how things work and how to release them. And I've had to order the craziest devices. I would show you, probably a little inappropriate for YouTube. I've gotten most of my diet back. I've introduced a little dairy, a little meat. You know, still trying to avoid really acidic foods. Tomato sauce, limes, you know, strawberries. I still eat blueberries, things like that. I started taking an antidepressant called Johns Wart. It's a natural antidepressant. So, not as chemically filled as that other shit that our doctors try to prescribe us. Because doctors look at our bodies and they do not know what's going on. So they automatically go, I think you have interstitial cystitis. And you say, what is that? And they don't really know what to tell you. Frequency, pain and urination, lower abdominal pain or bloating. The inner lining of your bladder is thin. There's rips and holes in the inner lining of your bladder. These are the things that the doctors tell us. Half of the time, they don't even do a cystoscopy. Half of the time, they just give you a written test, and then you sound like you have it, so they give it to you. They say, this is what you have, and then you are stuck with it for the rest of your life, and you are depressed, and you can't have a normal relationship, and it's horrible. Horrible that people don't understand this thing that has happened to us. Maybe it's a blessing in disguise. I've put on some weight again because I've introduced things back into my diet that I was missing. I think I look pretty good. Doing well. Healthy. I started taking this powder called Mannose. Got it at Whole Foods. You can get it in a pill form. I don't know anything about the pill form. I take it in my water. Put it in the water, let it dissolve. It's natural. and it's for urinary tract support. I did speak to one young woman who said that she took it with an alkaline diet and her IC went away completely. Yeah. I've been taking it and I'm still a little skeptical, wondering what it's going to happen to me. Urination has been healthy, the color has been clear. Sorry to get gross, but that's why we're here. We're here to learn about our bladders and what's going on and why we have so much pain. So, yeah, I still get little pains, like little sharp pains once in a while, and I think it's because in the Mannose there's traces of cranberry, which is acidic. That's right. No cranberry for us. Yeah. I don't really know what else. Well, this is just a little update. If I can think of anything else, I'll make another video. I'm kind of back, so to speak. I lost myself for a while, and I'm ready to come back. Still haven't tried intercourse or a normal relationship because it's so hard. And they run away the minute you tell them what's going on with you. Maybe this time will be different. I'll let you know.